I'm Pavel Rozhov, and this is Biofilm News, your source for latest news in biomedical research and industry. Please subscribe and spread the word, hit the notification bell to stay up to date. Let's get started. First of all, I really wanted to take a moment to say thank you so much for everybody who subscribed to my channel. This really means a lot and I really appreciate your support. I hope you would really enjoy the content going forward, and I look forward to bringing you more news and interviews as time goes on. Thank you once again. Now let's get to the news. Today's story comes to us from FierceBiotech, and it has to do with Fitbit. Obviously, most of the people are familiar with Fitbit as the smart wearable manufacturer. And the portfolio of smart wearables that Fitbit currently has is actually quite impressive. What's interesting though is the recent news that Fitbit plans to start a virtual clinical study that will actually study the heart arrhythmia in patients. It's actually quite exciting because Fitbit has been previously pushing the wearable platforms to thousands of people. So that means Fitbit can potentially enroll hundreds of thousands of people because of the fact that it has a number of compatible devices already out there in the field. Basically, if you would like to enroll, all you need is a Fitbit device that can measure a heart rate, which uses light detection technology to measure blood flow. I will definitely link the website where you can register for that clinical trial. But there's a few questions that I wanted to raise here. Number one, what would happen to all the data that Fitbit actually generates? Now that it has been bought by Google, would it be actually accessible by other companies such as Verily, for example, which is a known life science division of Google essentially? Second question is, how reliable that data would actually be. A recent study with Apple Watches has actually not provided conclusive evidence about the ability of Apple Watches to actually detect irregular heart rate. And the third question is, would you actually want to enroll in this study? Naturally, if I had a Fitbit, I would seriously consider doing that because I think ability to track this type of data is very advantageous for further development of algorithms and would be super important going forward. I think with an ability of companies such as Fitbit to push this type of clinical study to hundreds of thousands of people simultaneously, Fitbit would have an unprecedented ability to actually understand more about human health than ever before. And I think this is something to look forward to. However, let's stay cautiously optimistic and make sure to protect our data elsewhere. Thank you so much for watching, and I look forward to seeing you again. Bye-bye.